Now, meanwhile, Beldin Waliaola spoke to Dr. Githinji Gitahi, the Group CEO of AMREF Africa, on the surging numbers, reports of infections in schools, and the way forward as Kenya fights to flatten the curve. Listen in.
Over the times we've seen surging numbers in the country, we've also seen surging numbers in schools. Don't we think maybe the school reopening was a hurried procedure, or what can the schools do to ensure that the pupils and teachers are not affected, as we've seen in Mombasa?
Well, I think the school opening is an inevitable issue because, as you know, no one knows exactly when the virus stops spreading. We know that without a vaccine, we're going to see an elongated transmission of the virus over time. And it's going to move on from population to population because everyone is susceptible. Children, adults, all of us are susceptible to being infected by the virus. And therefore, the key question that we need to ask ourselves is, if we are waiting, you're waiting for how long? And no one can answer that question. And therefore, because we know that the effects of being out of school for kids can be extremely detrimental to their lives. We've seen rising teenage pregnancy cases, we've seen rising female genital mutilation, we've seen mental health illnesses rising. So we know that schools are necessary for the kids. So the question is, how do we balance benefit versus the risk? And the way to balance benefit versus the risk is to reduce the risk significantly by ensuring that the measures the public health specialists have advised in the schools are observed, as well as asking parents to take their role in talking to their children to ensure that they obey those health measures. Otherwise, the schools need to continue, the phased reopening needs to continue, and we need to ensure that, as we see the clusters arising by schools, we manage those clusters maybe by shutting down a school for a few days and then continuing, but we shouldn't move back on the school reopening, is my personal view.
But we know children are super spreaders. So don't you think that with now 2 schools having such a surge in numbers, don't you think it's going to affect almost the whole schools in the country because children are super spreaders?
No, I actually think that the super spreader events are more likely to happen in social places where we are going out to drink and hang out. And even what we've seen is that actually those situations where people are socially gathering, ignoring the usage of public health measures, are more likely to be super spreader events than children themselves. Now, we know that actually adults have gone out of their houses when children were in school, were at home, and brought the virus back to the children. So I think we shouldn't put children in a position where we see them as the risk to ourselves. We are the risk to the children as well. So in my view, it is important that we know that the children can and will get infected. We know that the risk of severe disease for children is low, and we know that the risk of children transferring the disease to their parents is there. The question is, how do we reduce that risk by ensuring observance of public health measures? Because you know what, life needs to go on, and we know that children are best served in school. As I've said before, there are many children who access their meals daily because they go to school. Now, if they don't go to school, then you have another issue that's brewing of undernourishment. There are many children who need special education, and their parents are not trained to offer special training. Those kids need to be in schools where the special teachers who are trained to do so are in school. So if we maintain school closures for too long, then the impact on the children may be bigger out of COVID than within COVID itself. So the most important thing is, how do we mitigate the risk of spread by observing the health measures that have been advised? But it's important to note that then the government needs to up its game on providing water and sanitation with soap to schools, not only for COVID, but also for diarrheal diseases, childhood pneumonias and others. So this is the time for us to reflect as society and say, what is dignity for our children? Not for COVID, but generally in their life. And that means access to water and sanitation for all, wherever they are.
You talk about mitigating the spread of coronavirus. What's the role of parents in this?
The role of parents is, if I talk to my child and explain exactly why we are doing what we need to do, explain, for example, that when you go to school, don't share masks. Use your mask as much as you can. We know it's going to be very difficult. We are not pretending that all children will obey mask wearing, correctly. But the more we reinforce that, children are extremely impressionable. They obey their parents. So parents need to play a role. So whatever the school does, is not going to be adequate until the parents play their role in educating continuously, reinforcing the messages, and ensuring they talk to the young children not to share items, to keep a distance, and not shake hands in school. Those are parental responsibilities that we must take up ourselves. And also obey them ourselves, because if our children don't see us obeying COVID-19 rules ourselves, why should we expect them to obey them when they go to school? So we must also convert ourselves into good role models for our children.
And also with the surging numbers in the country, we've seen a spike of people who are dying, we've seen a spike of those infected, and very few recoveries. People asking, are we experiencing a second wave or just a spike in the numbers?
You see, the first question you need to ask yourself is, did the first wave go? It did not go, you know. So we don't have a second wave, we have a spike in our wave. Generally what you see is that the original peak was driven by the first generation urban counties, what I would like to call first generation. That's Nairobi, Mombasa. But then we know that there are also second generation urban centers, you know, Eldoret, Nakuru, Kisumu. So whereas the first generation were actually going through their first wave, or their first peak, the other counties were just starting to receive their first cases. We expect, obviously, that those two peaks will not be the same. We expect that the first wave will start with the more urbanized centers, the ones that got the virus earlier, and then the second generation counties will start, as I've mentioned, Eldoret, Nakuru, Kisumu, and we still expect that even after those go through their peak, we expect a third generation peak as well from the lower urbanization counties. So we just need to expect that there is no single wave. There is one composite national wave, but disaggregated into different populations, because populations across the country are not homogeneous. They're different urbanization, different movement, different crowding, and we expect that cluster counties will have their own peak at their own time.
Can we take this spike to the ease of measures that were put?
No, I think, of course, the easing of measures. You remember that locking down a country is not a long-term strategy. It's a short-term strategy to ensure you prepare. So no country is going to lock up forever to lock away from the virus. So at some point, the measures will be eased. The question is, are we continuing the messaging, and are we continuing to ensure that our health system is prepared to take care of the people who may need it? That is what we are doing when the cessation was reduced, the movement was reduced, but that cannot be a long-term strategy. So we expect that when those are opened, there'll be a surge in cases. That's not unexpected. The question is, what do we do with those cases? Thank you.
And as Dr. Githinji has said, that parents also have a role in ensuring that the spread of the virus in schools is slowing down by telling their kids to maintain social distance and wear masks, and also maintain high hygiene while